Complications develop when diabetes is not controlled. These complications can be irreversible and worsen your health. So, we aim to delay or prevent them. In general, diabetes increases your risk of complications related to big and small blood vessels. The complications associated with diabetic small blood vessel disease include visions, kidney, and nerve problems. Complications of the heart and blood vessel, or what we call cardiovascular disease. Cardiovascular disease is a big blood vessel complications. Diabetes increases your cardiovascular disease risk complications by 3 times. Heart attack and stroke are the leading causes of death for patients with diabetes. You can change this by controlling blood sugar, stop smoking, being physically active, eating healthy diet, and avoiding excessive alcohol. By reducing your HbA1c by 1%, you can reduce the risk of heart attack by 14%, stroke by 12%, and peripheral vascular disease by 43%.
Do you know every 30 seconds worldwide, one patient with diabetes loses a limb? What causes it? Those with poor diabetic control lose their sensation in their feet and their blood flow is reduced. As a result, one cannot feel the pain even if an injury to the foot causes a wound. The wound will heal poorly due to poor blood circulation. Don't worry, this can be prevented by daily food self-care at home, and an annual assessment in the clinic can reduce the risk of food complications and amputation by 85%. You should seek medical attention immediately if you experience pain, tingling sensations, numbness, and skin changes. Make sure you also have your annual food assessment during your follow-up visit.
Do you know diabetes is the most common cause of preventable blindness? How did it happen? Uncontrolled blood sugar damages the small vessels in your eyes and causes bleeding and blurred vision, leading to blindness. Blood sugar control is important. By reducing your HbA1c by 1%, you can reduce your eye complication risk by 37% and cataract risk by 19%. Make sure your doctor checks your eye and the back of your eyes or fundus every year or more frequently depending on your condition. Sliding chart is used to test your visual acuity. This test can tell us your overall vision and how well you can see. Our normal vision is 6/6. After that, we will use a fundus camera to look into your eyes, focusing on the back of your eye to look for bleeding, scarring, or nerve problems. When and how frequently should I have my eye checked? For type 2 diabetes, at diagnosis and annually if without any diabetic eye complications. More frequent eye checkup is needed between 3 to 6 monthly for patients with diabetic eye complications. Those with any sudden or gradual visual disturbances should have their eye checkup immediately. A monthly self-home eye monitoring test should be done in each eye separately, and you should be able to read newspaper word print at a reading distance. Please see a doctor or eye specialist immediately if you cannot read. And for those of you with reading glasses, it is recommended to have an eye check with an optician yearly and change the glasses accordingly.
Do you know up to 40% of patients with diabetes will have kidney disease? Diabetes causes 80% of end-stage renal disease, and you are 10 times more likely to get end-stage renal disease if you are living with diabetes. To detect diabetic kidney disease, you need urine and blood tests annually, or more frequently if your kidney function is impaired.
Are you aware that diabetes can cause gum inflammation and tooth loss? What causes this to happen? Patients with diabetes are 3 times more likely to develop periodontitis, resulting in gum swelling, damage, receding gums, and tooth loss. Periodontitis can be prevented by controlling your blood sugar, brushing your teeth, flossing them daily, and having an annual dental checkup.
Sexual dysfunction or SD is one of the most common problems among diabetic patients due to end organ damage and psychological stress. All patients with diabetes and sexual dysfunction should be screened for heart and blood vessel, or what we call as cardiovascular disease. Sexual health is an important but often overlooked part of patients under diabetic healthcare. Do not hesitate to talk to your doctor and undergo regular screening on this too.
Generally, you should perform blood tests for HbA1c, cholesterol, kidney and liver function tests, and as well as urinary tests.
Electrocardiogram, ECG.
Food checks.
Dental check.
Eye checks, and
Sexual dysfunction screening.
at least once a year or more frequently if necessary.